Thank you, Kimberly. Good morning. It is my great pleasure as the Executive Officer of the Institute of Medicine, on behalf of our President, Harvey Feinberg, and myself, to welcome you to this public dialogue on IOM's recently released evaluation report on PEPFAR. I just want to take a minute for those of you who are not familiar with the Institute of Medicine to tell you a little bit about who we are. We are the health arm of the National Academy of Sciences, and we are an independent, authoritative, not-for-profit organization which works outside of government. We receive no directly appropriated funds from Congress, and we provide unbiased and expert advice to policymakers and the public. The National Academy of Sciences was established by charter and executive order under President Abraham Lincoln in 1863, and this year we're celebrating our 150th anniversary. The Institute of Medicine is the youngest sibling of all the academies, and we were established a mere 40-some-odd years ago in 1970. Among the many activities we undertake, our best-known product is the Consensus Committee report, such as the PEPFAR evaluation, which we'll be discussing today. And this is when a group of experts come together from many perspectives and disciplines and without conflicts of interest together over an extended period of time, provide recommendations to policymakers which are arrived at by consensus. We put a lot of emphasis on that consensus value. It's also, our reports are extensively peer-reviewed by typically over a dozen peer reviewers, and it's a long process, but it's a thorough and deliberative one. Some of our projects are congressionally mandated, such as the PEPFAR evaluations. However, over a third of our activities do not originate in Congress, the administration, or government, and come from outside organizations such as foundations who seek our advice. In 2003, President George W. Bush launched the President's Emergency Plan for AIDS relief, commonly referred to as PEPFAR. Over its first 5 years, PEPFAR supported the provision of $15 billion worth of prevention, care, and treatment for HIV/AIDS in 15 countries, 12 of which were in Africa. This represented the single largest commitment by any nation ever to an international public health problem. In 2007, and at the request of Congress, the Institute of Medicine issued a report entitled PEPFAR Implementation, Progress and Promise, which evaluated the first years of the PEPFAR program. I'm pleased to note that the findings and recommendations of that evaluation were cited throughout the reauthorizing legislation in 2008, and most of its recommendations were implemented. The current evaluation is new and independent assessment of the PEPFAR program and is not merely an update of the first report. During the 4 years it took to complete the study, both the planning and implementation phases, 12 meetings were held, 2 committees were formed, both committees led by Dr. Robert Black, who you'll shortly hear from, who will present the committee's findings. The staff and committee members conducted primary data collection in 13 country visits, conducting over 400 interviews. In-country time was equal to about 140 person weeks. Committee members joined IOM staff for each of these visits. Their work was rigorous, meticulous. I would like to personally thank not only Dr. Black and the experts who comprised our committees, but a very capable and ably led staff, very dedicated, who spent the greater part of the past 4 years traveling and giving up most of their personal lives for this project. And that would be Kimberly Scott and Bridget Kelly, who led a terrific team. Thank you. We in the United States should be proud that our nation stepped up in response to a global health crisis because it was the right thing to do, to help eliminate human suffering and the unnecessary death of people across the globe, and to restore hope for so many around the world. The PEPFAR program has ambitious aims and has made an unprecedented investment in population health. And recently, as we'll see by the evaluation, has been shown to make remarkable progress towards those ends. My fervent hope is that the recommendations of this evaluation report will have at least as much impact as that of the first report. I think it's a wonderful effort, an important effort, and I think it's wonderful that we'll be spending some time today going through those reports and recommendations and really thinking about the next phases, which are implementation. I'd now like to introduce Dr. Robert Black, who chaired both the Planning and Implementation Consensus Committees. Dr. Black is chair of the Department of International Health and the Edgar Berman Professor in International Health, as well as the director for the Institute for International Program at Johns Hopkins Bloomberg School of Public Health. Dr. Black is trained in medicine, infectious diseases, and epidemiology. He has worked as a medical epidemiologist at the CDC and worked in institutions in Bangladesh and Peru on research related to childhood infectious diseases and nutritional problems. He is a member of the Institute of Medicine and the advisory boards of the World Health Organization, the International Vaccine Institute, and many other international organizations. He has more than 500 scientific journal publications and is co-editor of the textbook Global Health. He served on multiple IOM committees and is on the board of what was then the Board of International Health, which is now the IOM's Board of Global Health at the Institute of Medicine. And please join me in welcoming Dr. Black and thanking him for his dedicated service over the course of this project and many others. Dr. Black.